In this video, I will explain the detailed structural and functional anatomy of temporomandibular joint in a simplified manner. This is the temporomandibular joint. Temporomandibular joint is classified as a synovial joint of the condylar type. In this joint, the head of the mandible articulates with the articular fossa and the articular tubercle of the temporal bone. Ligaments of the temporomandibular joint. The first ligament of the temporomandibular joint is the joint capsule. This is the joint capsule that stabilizes the temporomandibular joint and prevents its dislocation. Ligaments outside the joint capsule are called extracapsular ligament. Temporomandibular joint has three extracapsular ligaments. They are lateral ligament, which is this, sphenomandibular ligament, and stylomandibular ligament. Lateral ligament is the strongest of all the three ligaments. Stylomandibular ligament is not a true ligament as it is the thickening of the investing layer of deep cervical fascia. Joint capsule, lateral ligament, sphenomandibular ligament, and stylomandibular ligament all add to the stability of the temporomandibular joint and prevents its dislocation. Two unique features of the temporomandibular joint are: 1. The articular cartilage, which is this that covers the articular surface, is fibrocartilage and not hyaline cartilage as seen in other synovial joints. 2. There is present an articular disc. Articular disc is also called meniscus. This articular disc, which is present in the joint space, divides the joint space into an upper compartment and a lower compartment. The articular disc of temporomandibular joint is an oval fibrous plate, which is this. It has a thick anterior and a thick posterior band with a thin intermediate zone. Its upper surface is concavo-convex and its inferior surface is concave. Its posterior-most part divides into two laminae and is called bilaminar. This is its superior laminae and this is its inferior laminae. The functions of the articular disc are: it allows complex movements. It is so because it allows movements to take place in the upper compartment and the lower compartment simultaneously. It helps to stabilize the temporomandibular joint. It provides cushioning and shock absorption. It helps in proprioception, distribution of weight across the joint, and prevents friction. Blood supply of temporomandibular joint. This is the maxillary artery and this is the superficial temporal artery. Maxillary artery and superficial temporal artery supply blood to the temporomandibular joint. Auriculotemporal nerve, which is this, along with the mesenteric nerve, is responsible for the nerve supply to the temporomandibular joint. Functional anatomy or movements of temporomandibular joint. Do like this video and subscribe to the channel for more videos on anatomy. The temporomandibular joint of the right and the left side function in a coordinated manner to bring about the movements of the lower jaw. It brings about depression of the mandible during the opening of the mouth and elevation of mandible during the closing of the mouth. It also brings about protrusion, that is taking the mandible forwards, and retrusion, that is taking the mandible backwards, and side to side chewing movements of the jaw. Depression of the mandible is brought about by the lateral pterygoid muscle, assisted by the suprahyoid muscles, namely digastric, geniohyoid, and mylohyoid muscles. Gravity also plays a role in depression of the mandible. In the slight opening of the mouth, the rotation of the head of the mandible takes place in the lower compartment. In the wide opening of the mouth, along with the rotation of the head of the mandible in the lower compartment, Protraction or gliding forwards of the mandible in the upper compartment also takes place. This is so because the articular tubercle restricts the rotation of the head of the mandible. Once the head of the mandible glides forward, it comes to underlie the articular tubercle and thus is free to rotate further. Elevation or closing of the mouth is a powerful anti-gravity movement which is generated by temporalis, masseter, and medial pterygoid muscles. Masseter on the outer surface of the ramus and medial pterygoid on the inner surface of the ramus forms a kind of a sling around the ramus of the mandible and helps in its elevation. All the movements that take place during the depression of the mandible are reversed during the elevation of the mandible to close the mouth. Protrusion or the forward movement of the mandible is the movement that takes place in the upper compartment of the temporomandibular joint. The articular disc, along with the head of the mandible, glides forwards, taking the mandible along with it. Muscles involved in bringing about protrusion includes lateral pterygoid muscle, medial pterygoid muscle, and masseter. Retrusion is the backward movement of the mandible which takes place in the upper compartment. In this movement, the head of the mandible along with the articular disc glides backwards, taking the mandible along with it. Muscles involved in retrusion of mandible are the posterior fibers of temporalis, the deep fibers of masseter, geniohyoid, and digastric muscles. Side-to-side movement of the mandible. At the time of chewing food, slight rotation of the mandible takes place alternatingly on the right and the left side. This movement is brought about by the medial and the lateral pterygoid muscles. When the medial and the lateral pterygoid muscles of the left side contract, it will move the mandible towards the right side, and when the muscles of the right side contract, it will move the mandible towards the left side, thus bringing about side-to-side movements of the jaw. To like the video, click here. Learn entire head and neck anatomy in just 10 hours. Click here to go to the entire playlist. For fast and easy learning series, learn muscles of mastication in 5 minutes and parotid gland in just 6 minutes.